Hey, this is Dr. Ryan Bell with Yada Yada Pediatrics. Let's talk about picky eaters. A lot of toddlers tend to be picky eaters. It's actually part of their job description. Being a toddler, you're supposed to get a little more of an idea of what you're in control of in your world, and eating is definitely the top of the list. So as we approach a picky toddler, there's a few really important things that we look at, and then maybe some strategies we can talk about. For me, the first thing is making sure that weight gain is still okay. If your child's a picky eater, but they still are growing well on a growth chart, then we're not going to be nearly as worried as if they're falling off their growth chart, if they're losing weight as we go. Those are big red flags that they need more of a workup, and that would be a different discussion. For most toddlers, they're still growing well. They do a pretty amazing job of eating enough of what they need in order to continue to grow. So we'll watch those growth charts carefully, but often those are pretty reassuring. As far as a goal for those kids, I really like to have parents still try to put healthy foods in front of them, breakfast, lunch, dinner, maybe a couple of snacks in between, and have the goal of trying to get them to at least taste everything that's on their plate. Even if it's one taste and they're done, or one taste and they spit it out, that's okay. And as a parent, that's really about all you can control, is trying to just help them to continue to taste those foods. They may find with time that they actually like some of them, or that they need some of them, and they'll begin to eat a little better. So don't give up on foods. Try to still at least get them to taste it. Other strategies we can look at would be something like a Pediasure or a Carnation Instant Breakfast Boost for kids. Those protein nutrition drinks are actually really good, and kids could live on those for the most part. So doing one of those once a day or even twice a day in extreme cases can be really helpful. We really try to encourage other foods that have healthy calories, foods like eggs, peanut butter, dairy foods, yogurts, cheeses, milk. There's a number of different things you can try. You can try to add butter to foods. You can try to add cheeses to foods. So continue to encourage those foods that you feel like are good, healthy calories, and include something in each meal that you feel like there's a good chance that your toddler's going to take. Milk is a good foundational food depending on their age. Usually between 1 and 2, we try to do whole milk, up to 24 ounces in a day. 2+ for me, I usually recommend that they do a low-fat milk, but still no more than 24 ounces in a day. But those things are good kind of baseline foundational foods, and then you just continue to try to get them to taste it and see if they'll warm up to some of the other things and to branch out. I see the pattern quite often with toddlers that they'll do one good meal a day, usually breakfast it seems like, and then after that they're just kind of picking and playing at it. Other red flag concerns would be if there's other developmental issues, if you're having other symptoms that make you worry that your child is sick or otherwise not functioning properly. Sometimes there's more of a workup involved in those kids that refuse to eat, but usually only if they're gaining weight or there's other symptoms or concerns.